Hello, Mr. Kwanzi. This is Mr. Chu. I'm calling you to remind you that you should not be performing any exercising tomorrow, and you should not have any alcohol, caffeine, food, or tobacco 3 hours prior to testing. Okay? Yeah. So remember your attire and to drink plenty of water. Okay? All right. See you tomorrow. Hello, Kwanzi. I'm Mr. Chu, and today we're going to perform the Tandem Gait test. So this is an indirect measure of dynamic balance. So ideally we will use a dynamic posturography, but unfortunately we do not have access to the equipment. So this test will assess your balance. So balance is important as in your case, it helps to prevent injury in sports as increasing your balance will enhance your neuromuscular responses for co-contraction of aggregates and antagonist muscles that help to enhance joint stability. So before we begin, are you feeling well? Okay, so if anytime during the test you feel unwell, do let me know so that I can stop the test, okay? So do note for all balance assessments, if you have any of these symptoms, the test will be terminated. Onset of angina or angina-like symptoms, significant drop of systolic blood pressure over 20 mmHg or systolic blood pressure fails to rise with increased exercise intensity. Excessive rise in blood pressure, so systolic blood pressure increases over 260 mmHg or diastolic blood pressure increases over 115 mmHg. Signs of poor perfusion, lightheadedness, confusion, extalia, pallor and cyanosis, nausea or cold and clammy skin. Failure of heart rate to increase with increased exercise intensity, changes with heart rhythm, or you request to stop, physical or verbal manifestations of severe fatigue, or failure of the testing equipment. Okay. So to reiterate from our previous meetings, as my client, you must fully understand and be aware that you are volunteering to participate. You have responsibilities in informing us of any problems that you may be experiencing. You are free to withdraw from participation at any time with no consequences. You are allowed a Q&A session with me. You should know that the benefits of this assessment is that I am able to identify whether a balance problem exists, and if there is, the underlying cause of that balance problem. It is also to predict risk of falls and to determine the effectiveness of intervention and to evaluate rehabilitation or training programs for you. You should also know that the risks involved in this assessment include fatigue, muscle soreness, irregular heartbeat, chest pain, or even sudden heart attack, but we have measures put in place to reduce the risk of these. You should also know that there are alternative assessments like STAR excursion balance test or the STOP test. So if I have your full informed consent, please sign this consent form. Alright, thank you. So now I'll be measuring your blood pressure and your heart rate. So please. Yes. So I'll also be doing this after the assessments. This is to ensure that I have a baseline reading of your heart rate and blood pressure, so that after the assessments, I can see that it has gone down to normal levels. This also allows us to check for hypertension, hypotension, syncope, bradycardia, and trichorrhea. Okay, so now we'll be moving on to the warm-ups. So first up is the 30-second leg swings from side to side, 15 seconds left leg, 15 seconds right leg. So I'll just demonstrate first. Just keep the motion nice and slow. Same for the right leg. You can lean against the wall if you need. Okay, then next will be 30 seconds of ankle rotations. So keep it nice and slow. Go through the full range of motion. So 15 seconds left leg, 15 seconds right leg. Okay, then next will be 30 seconds of trunk rotations. Okay, so you understand? Alright, so let's begin with that. So first 30 seconds of leg swings. Begin with your left leg. Remember, keep the motion nice and slow and steady. 15 seconds up, change your other leg. Nice and steady motion. Okay, very good. 15 seconds up. Okay, so next will be left leg ankle rotations, 15 seconds. So remember, keep the motion nice and slow. Go through the full range of motion. Okay, 15 seconds up, change leg. Okay, 15 seconds up, change leg. Okay, done. So now will be the trunk rotations for 30 seconds. Go through the full range of motion. Keep it nice and slow. Nice, slow and control. Okay, 30 seconds up.
I just did 1 second before. Okay.
Okay, so how the standard gait test works is you you stand on this start here and you walk down the line, one toe in front of another. So you must make sure your heel is constantly touching the toe. So you walk all the way down to the end of the 9-meter line, and then you come backwards. So once you, for example, I'm at the end of the line, come backwards. So take heel to toe on the line. So walk all the way back to this original line. Throughout the entire test, I'll be standing to your side spotting you to ensure that you don't fall, and if you do, I'll be able to catch you. So while you're doing it, I'll be assessing a few things. 3 things. The first thing is if you walk off the line, so you're walking and you fall off the line, I'll be marking that down. As well as if you're walking and you have to lean onto the wall, or if you're walking and you fall off and I have to catch you. So I'll be marking down those 3 things. Yeah. So before I begin, are you familiar with this test? Alright, so I'll give you 5 demo attempts. This is because, as you know, the more you practice, the more familiar you'll get with the movement. Yeah? So, however, studies show that after 5 trials, the scores for this test will stabilize. So hence, to keep it constant at 5 demo trials, this is to ensure that you are properly acclimatized to the test, as well as if you are doing it in the future. You may try to find it now. So now you have 5 demo attempts. Okay, so are you ready for your proper attempt now? Remember, I'll be taking down the amount of time you walk off the line, lean on the wall, or lean on me. Okay, you may start. Okay, so how are you feeling? Are you feeling sick or unwell? Okay, so you ready for a quick cool down session? Alright, so it will be first 15 seconds of ankle plantar flexion, followed by 15 seconds of ankle dorsiflexion, followed by 15 seconds of ankle eversion, followed by 15 seconds of ankle inversion. So we'll be repeating this on the right leg. So you clear with that? Okay, so let's go. Plantar flexion, 15 seconds. Okay, 15 seconds up. Let's do dorsiflexion. 15 seconds up. Okay, let's do inversion. 15 seconds up. And let's do eversion. 15 seconds up. Okay, so change leg. Plantar flexion. 15 seconds up. Dorsiflexion. 15 seconds up. Ankle inversion. 15 seconds up. And ankle eversion. 15 seconds up. Okay. So I'll be measuring your heart rate and blood pressure to ensure that they are as close to their resting values. So according to the readings, your blood pressure and your heart rate are back to normal levels. So based on the results that you achieved, you did not show any signs of balance loss or any indications of balance loss, as you did not walk off the line. Nor did you lose balance and lean on me or another object. So good job. However, despite that, you still do need to continue to work on strengthening your stabilizer muscles as well as your fitness level, as a decrease in fitness level will result in poor neuromuscular responses for co-contraction of the agonist and antagonist muscles that enhances joint stability, making your balance worse. Okay, so if you are feeling alright, that's all for the balance assessment. You are now good to go.